And we would love if y'all would take a moment to introduce yourselves in the chat. Can y'all hear me okay? Okay. My name is Kelly Klein. My pronouns are she, hers, and I am coming to you from the partly cloudy Nashville, Tennessee. I'll be one of your hosts today, along with my colleagues Taryn Vivo and Mayang Hale, and they'll introduce themselves in just a moment. We're going to go ahead and get started because we have some introductory things to work through, and then we'll get into the meat of things. So after some brief housekeeping and some important acknowledgements, we'll spend some time level setting and defining some key terms around gender identity and gender affirming care. And then we'll discuss some challenges and promising practices related to gender affirming medical respite care specifically. And then we'll end our session with an awesome conversation with Mayang about gender affirming medical respite care in action. We'll also have some brief time at the end for discussion and questions, but feel free to type any questions you have in the chat along the way, and we'll try and answer them as we roll on. Although we're here today in a virtual space, we are all interconnected by the land beneath us. Most of our communities reside on unceded ancestral lands or acquired by unhonored treaties. We acknowledge the people of these lands, past and present, and honor with gratitude the land itself and its people. We also honor the brilliance and humanity of all immigrant labor, including voluntary, involuntary, trafficked, forced, and undocumented peoples, whose labor often contributes to our physical environment, remains hidden in the shadows, but still contributes to the well-being of our collective community. By recognizing the land that was taken from First Americans and the forced labor that was provided by enslaved Africans and Black and Brown people, we strive to take steps to create a more equitable and just world for all of us. And we're coming to you today from across the country, so we encourage you to take a moment after the webinar to learn about the land that you're on using the link in the chat. Like I mentioned before, my name is Kelly Klein, and I'm the clinical manager with the National Healthcare for the Homeless Council. You'll see my name on a number of different gender affirming care projects here at the council. My professional background is in housing navigation and case management for queer youth here in Nashville. And I am just so delighted to be here with y'all today. Taryn, do you want to take a moment to introduce yourself?
Yeah, thank you, Kelly. Hi, everyone. Taryn Bilo, also with the National Healthcare for the Homeless Council, working with the National Institute for Medical Respite Care in Nightmark as well as a program manager on that team. So I am based in Portland, Oregon. And before I got here last year, I lived and worked in Olympia, Washington, providing homeless services. And part of that was starting a respite program with some really awesome colleagues, some of who I think are in this room today. Yeah, and I'm just so happy to be here. And I just got my master's in public health. If anyone wants to give me a gold star. And that's it.
I'll give you a round of applause. All right. And thank you all for your introductions in the chat. We really appreciate knowing who all is in the room with us today. Let's go ahead and dive into some foundational terminology and concepts for today's discussion. We just want to make sure everyone is on the same page because we know sometimes people mean different things by gender identity and gender affirming care. So we just want to clarify the perspective that we're coming at you from in this presentation today. Today, we're going to focus on promising practices for providing healthcare to people for all gender identities. We identify this as illustrated here with my favorite diagram on the right, the gender unicorn, as separate from gender expression, sex assigned at birth, and physical and romantic attraction. Another way of defining gender identity is that it's a person's internal sense of self and their gender. So how the heart and the mind regard the self. You can't know someone's gender just by looking at them. So generally we usually recommend that you use the words to describe somebody that they use to describe themselves. And for the purposes of this presentation as kind of broad terms, when we say cisgender, we generally mean that someone's gender identity aligns with their sex assigned at birth. So if someone was assigned female at birth and they identify as a woman, for example, then they might also identify as cisgender. Similarly, but slightly different, is the term transgender, in which we're saying that someone's gender identity may not align with their sex assigned at birth. So an example of that might be if someone was assigned male at birth, but they identify as a woman, they may also identify with the term transgender. However, I would be remiss not to include that we're using trans and gender diverse as kind of an umbrella term, and not everybody who has gender diverse identities or is not cisgender may identify as trans. So this again is where that foundational principle of use the words that people use to describe themselves comes in. Using the umbrella term of trans and gender diverse is helpful to talk about some similar experiences, but I do want to emphasize that there's as many experiences of being trans as there are trans people themselves. So it's helpful to remember that we talk about these things from like a public health perspective, but when it comes down to client care and clinical care, it's important to kind of make sure that you are personalizing your language for each person in front of you. So what is gender affirming care in this context? Gender affirming care can be used, that term can be used to refer to a number of different things. I love this visual and chart to help explain the different modalities of gender affirmation. It can be anything from legal modalities, which would include changing things on birth certificates, social security cards, medical records, driver's licenses, for example. It can include interactions with the criminal legal system, potentially. There's also social modalities of gender affirming care. This is where gender expression can come in if desired. Doesn't always need to be linked to changes in gender presentation, but sometimes gender affirming care includes social gender affirmation, and that includes using the right pronouns, using the names that someone wants to use for themselves, not using names they don't want to use for themselves, presenting in a certain clothing style or gender expression, among a number of other different social forms of gender affirmation. And for the context of medical respite care, this medical bucket here, I'm not sure, can you all see my cursor on the screen here? No, okay.
No.
Well, this medical circle here in the center of the screen is helpful for the context of clinical staff at medical respite centers. And that can include anything from hormone therapy, whether that's estrogen therapy, anti-androgen therapy, or testosterone therapy, to things like birth control. It can also include a number of other interventions that can lie on a range that may even go up to surgical interventions. And that can include things like chest or breast augmentation or reconstruction, hysterectomies, as long, in addition to a number of other interventions listed there. What's important to note about all of these modalities of gender affirmation is that they are all chosen based off of the individual's goals for their own life and their own presentation. So someone may identify as transgender, but may not be interested in pursuing surgical interventions. And what's important for the medical respite care provider to know is to not make assumptions about what people do and do not want based off of the range of options available to them. So from the point of view of a provider, you can think of it as kind of a menu that you can offer to people if this is something that you're interested in pursuing at your program. And from our perspective at NIMARC and the council, we certainly think that this is something that is worth pursuing, which is partly why we've decided to host this webinar. The data around health and housing disparities around trans identities and gender diverse identities and homelessness is pretty staggering. In the last US transgender survey, which is the largest transgender survey in the United States, the 2022 version, early insights just came out, but the last source of comprehensive data that we had was from 2015. And one of the kind of staggering numbers from that survey told us that 30% of respondents to this survey have experienced homelessness in their lives. So it's a lifetime homelessness rate of 1 in 3. To put that in perspective for you, the lifetime homelessness rate for the general population is anywhere from 0.7% to 3%. You can see how the disparity there is truly staggering. And the disparity doesn't only exist between homelessness and being housed, but also in sheltered versus unsheltered homelessness experiences. So you can see in the data here on the right that gender minorities are more likely to experience unsheltered homelessness, which we know is connected to a range of adverse health outcomes. And when asked, or when they delved deeper into why this was, why unsheltered homelessness seemed to be more prevalent among folks with gender diverse identities, 7 out of 10, 70% of respondents who stayed at a shelter of some kind in the past year faced some form of mistreatment, such as being forced out, harassed, or attacked because of being transgender. And that doesn't include more minor forms of abuse or harassment, like dead naming or using different pronouns or not feeling welcome. This is just looking at harassment and violence. So you can imagine that making sure that all of our programs are gender affirming is essential to addressing some of these health and housing disparities. With that, I'll pass it to Taryn to talk about what we can do about it.
Thanks for all of that level setting, Kelly. Yeah, and one thing that is kind of a goal from this beginning stage of this project is for Kelly, who's on the clinical team, to bridge that with our work with NIMARC as well, and kind of the medical respite field into other quality improvement clinical best practices. So one thing that we did realize through this project is that there is like a lot to learn, and a lot of level setting is needed for us to have these conversations with where we are as far as medical respite care providers and providing services to trans people experiencing homelessness. So this is the first step of a 3-year project between the council and NIMARC that we're working together on. And we did a series of interviews, reaching out to different medical respite care providers to kind of assess where they are as far as skills within developing services for trans people experiencing homelessness. One thing that we did realize is that there is some pretty significant gaps. And starting with challenges. So through our 8 interviews, one of which was with a consumer, the other with respite care providers, including my young, who is on this call, we identified kind of 3 main themes of challenges happening within these services. First being that trans and gender diverse clients face a higher risk of targeted harassment and violence from other medical respite care program clients, specifically within the residential setting. Another is increasing staff comfort and competency to provide gender affirming services within those settings, and there is a variation depending on individual life experience, as well as kind of like capacity of program, as well as like ability for training. The last challenge, that's a larger theme that we identified, was that there are kind of barriers between pre or post-operative gender affirming care surgical stays within medical respite care settings because of both really high utilization and need for programs to triage kind of referrals based off of acuity, as well as the planning nature of gender affirming care surgeries versus the more acute responsive nature of medical respite care stays. Yeah, so kind of thinking about that, we're going forward with some promising practices that we've found through these initial interviews, and we look forward to building off of this, and we have some next steps that we would love for people, especially any experts that we have in this room or people with lived experience, to participate in developing these out further. So just get to this slide. We have 6 more thematic promising practices that we're going to go dive into a little bit more through the next slides. The first of which is, sorry, my notes are a little all over the place, but that increasing trans competency trainings into staff onboarding and continuing education within medical respite programs is one thing that all programs that we interviewed identified as very crucial, as well as something that they would love to have more resources or tools in their tool belt. So one which Kelly wanted to highlight is the Fenway Institute, which I am going to put into the chat, who has been a partner with us for different projects, especially ones that Kelly has worked on. And then on the next slide, we have another resource for that I'm going to put a pin in right now so we can go over promising practice number 2. The second is kind of going back to that short-term model of intervention that medical respite care is, which is a challenge between establishing pathways within kind of like the capacity or scope of the respite care program to more long-term, either any kind of like gender-affirming care referrals. So programs noted particular success with having like really strong either internal like other department community health partners or established pathways with gender affirming care specific clinical services, and how having those external referrals was a really important part of being able to support people in the programs with being connected to longer term care. So going back to talking about training, which is really what the council is here for, is that, well, first, there are so many resources in general, but our Foundations of LGBTQIA+ healthcare and homelessness terminology, concepts, and best practices is a great certificate for anyone here who wants to, it's a free resource that also gets a certificate. So for any staff onboarding or other things for anyone that has a program that's in this room today, I will pull the link to that, or if someone else from the team can, when I switch gears a little bit, that would be awesome. And then we do also just on our website have like a pretty extensive backlog of services, or not services, but trainings for service providers. Going to promising practice number 3. Prioritize client choice and autonomy when considering room assignments in gendered residential spaces. So this was an overarching theme among all interviewed providers, and especially as kind of like a lesson learned based off of defaulting to if there was any kind of like single resident occupancy unit available, providing that to trans people without consultation as a way to prevent or get ahead of some potential like roommate or other residential conflict, which is like one of the biggest challenges that was named as far as providing like a safe and healing space for clients. Yeah, all programs provide, all programs that we interviewed also highlighted that it is important to just, provide people options for navigating these gendered spaces, and working and being like as flexible as possible with clients to support them in whatever way feels good to them. Promising practice number 4, identify a staff champion to advance gender affirming efforts and secure leadership buy-in. So another thing that was a theme across our interviews was that all programs that were more advanced in their ability to provide services or had more policies or procedures built out, that really came from staff bringing that to leadership, or rather than it being like established within their policies and procedures when the respite program was started. So one way to support this is to have intentional allocation of staff time towards this effort, as opposed to just creating additional tasks for specific people who are interested, or something that just falls a little bit more on everyone. Next slide, please. Okay, so promising practice number 5 is to establish collective agreements for all staff and clients that include anti-gender discrimination policies. So every program that we interviewed includes transphobia and transphobic language in their definition of violence within their no violence or space policies or space use agreements. And all programs also noted that it was really important to review this and set all expectations around behavior, just, across the board, but specifically with targeted behavior or harassment at the intake for each client, as well as what they can expect for staff as far as like support and response. Every program also that we talked to reported a history of having to need to discharge other clients for targeting trans clients, either with verbal harassment or physical violence. So that kind of goes back into the staff onboarding and training and really having expectations set for how people respond to each scenario consistently. The last promising practice is to prioritize community over isolation. For instance, 2 examples is establish trans and gender diverse support groups and community events. One program that we spoke with instituted weekly support groups run by the Director of Transgender Services. And since this programs or group started, staff noted an increase in trans and gender diverse clients that, overall, as well as length of stay. So as a marker for kind of how successful this intervention is. Two programs also noted that they noticed significant increase in length of stay when there was more than one trans client within the medical respite residential setting at the same time. Yeah, so moving forward, we are happy to be here today with Mai Young from the Edward Thomas House in Seattle, Washington. She's a mental health provider on site, and I think she might be in an office in the program right now. So thank you so much for being here today as one of the people that we were able to interview and do a site visit with. Just really appreciate your time and expertise here. I'm wondering if you can give me just a brief description of kind of the model of the Edward Thomas House and specifically like your relationship within the hospital, what your residential setting looks like, how your dorms are kind of laid out, and then also your policies.
Okay, sure. So I'm Mayang. I'm really happy that I'm here and share the space with everyone. I am happy to kind of introduce a little bit about medical respite. So we're based in Seattle. So we are supported by several participating hospitals and public health. We do have 18 beds right now, but typically we have 34 beds in capacity. We're going through construction. Just to give you a good picture of our program, it is we are renting a space through Seattle Housing Authority. So we have this one floor that's really designated for us. But as I mentioned, right now we are like a smaller capacity because of construction. So our program accepts all kinds of medical, but mainly like wound care. But we also do a lot of care coordination, for instance, for folks on hemodialysis, folks on cancer coordination, etc. So that's in general. So in terms of space, we have now just 6 rooms, and in each room we have 3 patients. So how it works is that there is really no like designated, like this room is for female identifying, this room is for male identifying patients. So how it works is just we base it on our demands, how many patients are there, and how many rooms we will designate for female identifying versus male identifying patients. So we had, as mentioned from the beginning, there's a lot to learn in this area of really providing a, a good gender affirming care in respite, but we had a lot of practice because we have several folks that over time that we have given care in our program. So Taryn, you were asking, like, in terms of like policies, I can start with that. So for patients, even prior to coming to respite, we have admission coordinators. Admission coordinators are the one who screen from the referring hospitals. So from the get-go, there is an understanding of a policy of respect that we do not support any discriminatory action. So there is already some screening that is done. And then when they come in, so we welcome them. There's a team of folks, mental health specialists, who reviewed patient agreement forms. So in that patient agreement, one major thing that we discuss is like expecting respect from everyone, staff and other patients. In that agreement, definitely no violence is really emphasized. And then there is, as I kind of mentioned to you, like it's a mix. Like in that one hallway, there could be male identifying and male room assigned to male. So we also include in the patient agreement that there is no visiting, there is no going to another person's room. So no standing in the hallway, no doing personal business in the hallway. So from that patient agreement, we kind of explore that even more. For each patient, there is a mental health practitioner that's assigned. And so when we do also like psychosocial assessment, that's also reviewed. And then in terms of practice, we do honor for sure the preferred pronouns. We definitely use the preferred names of our patients. So as Terrin said, like we don't assume just because a person says I am a transgendered male, we don't take it on us to assign them to a room that we think is a good fit for them. So what we do is ask the patients what which room that they will feel safe in, and that's when we assign folks to be in. Darren, is there anything else I'm not covering?
I think that was a great intro. Thank you. Just wondering, going into kind of speaking about the residential spaces, because that was like such a big theme among our interviews as well as in our TA requests. Can you give any examples about responding to challenges within either like roommate dynamics or how your team navigates many clients in the same space?
Definitely, because okay, Taryn, even outside, it's a group setting, right? So definitely there's always to start with a lot of potentials with people, like adapting to a group setting, just having to live with a roommate. So for sure, because in larger society, there's as we said, there's a lot of discrimination, there's a lot of marginalization with folks. So I can give two instances when it is a challenge. So we have for instance, like a female identifying trans person who preferred to be in a female room. However, in that setting, we also have a cisgender um, older female who is also has a belief system of being a Muslim. It's from Islam religion, and there we have, of course, a clash of like orientation values. So the cisgender female is definitely not very happy and citing that in their culture they're not really allowed to be in the with in a room with an opposite sex. They're in her faith system, like, and in culture, like, it's only if they're married or um it's their husband or children or any relatives, that's the only time they can be in a space with the opposite sex. And so there's a lot of like rejection, demands, saying that I can't be in a room with this person. And so what we did was definitely talk to both of them. We have at that point we have the luxury actually of like removing the female a person to get into an isolation room because we have that space. Eventually, that's how it ended, because we cannot. There is we do a lot of listening and exploring with the other person, like what is exactly distressing to them. But the female definitely has strong belief system. Even the family that she contacted really advocated that she can't be in this space with the a person that identifies as male, um, even if their assigned sex at birth is female. So they really don't want to be in that space. So what we did was transfer them in an isolation room, because we have that space. Um, there is another example of when we we have um, we have we don't have that kind of ability to put somebody in the room, and then the other patient was really not kind of working with us, and really a lot of like harmful speech. So we did eventually end up like discharging the person, because it's just not gonna work. I did I did mention about the patient agreement from the get-go, but we also have actually this guidelines for harmful speech. That is separate, and that is something that we discuss with our folks, try to um, explain how it looks like and what are the expectations in not tolerating harmful speech. So we in some situations we have to discharge folks that are really not able to be in a safe space with other transgender folks. So that's it really is challenging.
Thank you for that, Megan. Going into our next kind of bucket of themes that we found in this initial findings is, can you speak to either how your staff team, how you encourage your staff to increase their competency for supporting trans clients, either through training or I know you mentioned in your team having like team meetings as well. I don't know if, am I the frozen one here? No, okay. I don't know if you heard me, Mayung, but just thinking about, I know what kind of trainings or other staff competency interventions does your team have? One thing I know that's really strong is that we should touch on as well is your relationship with Harborview.
Yes.
And the gender diversity training that
Yes.
the trans services.
We definitely are. We are very, very fortunate. We are connected with Harborview Medical System, and we are also connected with UW. That's the University of Washington. So we have this huge program. It's called the Transgender and Gender Non-Binary Health Program. So they do offer on a regular basis this gender sexual diversity training, and not just that training, but they also do other stuff like identity privilege and intersectionality, bias, and microaggressions. So what we do is we have our folks enroll in those trainings. We also have because we also have in our meeting, we kind of bring that up and also do kind of one-on-one, because in my opinion, Taryn, like there's a formal training, but there's also a lot more. I think that more like conversations, like really more like talking to each individual. I have staff, for instance, who ask like, I'm confused with this patient. What are they really? And then that for me is a good, instead of saying, hey, that's attend the training, we kind of say, let's sit down, let's look at all what your question is and what can we do, what can we uh, uh, how can we have a good discussion about this. So there's the formal, and then there's of course the ongoing. But yeah, for the formal, as I said, we're just fortunate because we are connected with UW. It's free. There's a lot of training that's been offered just because of our connection with the university and Harborview Medical Center.
Thank you. And that is where you refer clients to as well for gender-affirming care services, correct?
Yes, yes. That's also where our patients can go.
What does that referral pathway look like? Or like what does that referral pathway look like for your
So
team?
they have this wonderful website that kind of really give a very clear pathway to referral. So I can send the link to you. I think from what I read, they have this primary care referral, and they already have a specific requirements that they're looking for. So yeah, they do have it in their website. I think PCP referral, and then there's some steps and people to contact and what are the steps that will be followed.
Thank you for your time today. Great. Well, Kelly, I think I'm going to pass it to you and we're going to move to next steps. And then if anyone has any questions for the Q&A, Mayung and Kelly and I will be here then.
I would say this is a great time to go ahead and start typing those questions in the chat so we can start getting them rolling too. Just an FYI on some upcoming resources in June, so in just a few months away, we're going to release a publication version of this information called Gender-Affirming Medical Respite Care, a quick guide. Our hope is that this will not only be a great kind of quick reference text-based version of this information that if you need to, you can print it out, but also something that you can send to supervisors or leadership as a good list of things that programs can start doing or continue their efforts doing, and an organization to reference outside yourself if that's needed in order to secure buy-in. And then in August 2024, we are also opening enrollment for a Gender-Affirming Medical Respite Care Learning Collaborative, and this is a peer-led space for folks from medical respite programs and organizations that support those programs in order to improve their gender-affirming care in those settings. And this will cover everything from the legal modalities of gender-affirming care to medical to social. So we're really going to take a comprehensive approach in this learning collaborative and bring in a number of different programs who have already faced some similar challenges, as well as some national experts who have kind of been working in this field for a long time. If you're interested in hearing about these resources as soon as they're released, the best way to keep up to date is to join the NIMARC mailing list. And if you go to nimarc.org and scroll all the way down to the bottom, there's this button that I've highlighted here that says join our mailing list, and you'll get emails as soon as all of those resources are released, in addition to all of the other incredible resources that NIMARC releases what seems like daily these days. So lots of really great opportunities to learn. We really encourage y'all to join. It'll be a great way to get support enacting some change that can be very difficult given in some places the politicized nature of this very basic care. So our goal is to establish this as gender-affirming care is primary care, and here's how we can build to a more inclusive medical respite landscape.
I think there's a question.
So we know, yeah, go ahead.
Kelly, so there's Julia, thank you for your question. So Julia's wondering about how many of our respite clients are trans and how many folks a year. So as I mentioned, so we have varying number of patients. Our capacity is 18, but in terms of trans, because their stay here is very short term, right? So from average of 3 weeks, and then very few that are stay for months. But there was I can't really say like how many we have, but there was a time that we have in a room, like we group all trans person who identifies as female. So they're all in a room. It was very lovely because they were able to really share from makeup to clothes to, like, you know, where they go. So it was really lovely that we have at one time like 3 folks that are in the same the same the same room. But we can't really, I probably in a year we have I guess like 2 to 3 folks that come. I mean, very recently we have more, but they come and go. The other piece that we hear, they really like respite because of the safety, the safe environment that we provide. They often talk to us about how they get harassment in other shelters, and so that's also one thing I forgot to share is that the discharge planning is kind of challenging for folks. We have this shelter that we know is very supportive. It's called the Mary Pilgrims Inn. It's not related to us, but we have a strong connection with them. So we definitely try to get our folks in that shelter. There's also another shelter that we know is very supportive, Bailey Boucher, also in Seattle, Washington. Unfortunately, there are folks who even choose to be in the street because their experience of just in general outside of these 2 shelters, their experience of shelters are really negative, as I think Kelly pointed out, that there's folks that don't even want to be in shelter because first it's limited, and second they don't feel safe. So it is really a challenge to even um, help them do discharge planning because of limited resource and just the general environment. I don't know if that answers the question, Julia.
Yes,
Let me
thank
know.
you. Yeah.
It sounds like y'all have found some really lovely moments of joy and community too. I think that's one thing that I heard from a lot of programs that I visited, that this work can be very difficult, but it can also be such a source of joy and fulfillment too, when you realize that you're filling a need in a community that is faced with discrimination in so many places where they shouldn't be. So kudos to y'all's program for taking the initiative to pursue that too. I also did just want to add, kind of on a related note to your question, Julia, about numbers of trans folks in programs. One of the questions we get, or sources of feedback that we get from some respite programs, is that it can be hard justifying some gender affirming efforts to leadership if you have low counts of trans folks in your program, because the thought from leadership may go that, you know, this is a lot of effort to put in for only one or two people who may self-identify in a program. And one of the things that we heard over and over again was that once people made the efforts to establish referral pathways, to train their providers, to make it known to patients who are being referred or looking on their website that this is a safe place, that their numbers started to increase dramatically, and word of mouth spread that this was a safe place to be. And soon they went from seeing 1 or 2 trans patients a year to 30 to 40, just with the introduction of a few of these promising practices. So I think that not only is a testament to the great need that exists in a lot of communities that's often invisible for a lot of our systems, but also a lot of the power and opportunity that lies with respite programs to kind of be one of the organizations that steps in and says, you know, this is unacceptable that these services aren't being provided, and we're going to start initiating that, which it sounds like Edward Thomas House has done in Seattle too. Are there any other questions from folks? Or it can just be comments about what you've seen in your community. Sorry for the dog in the background. And was there anything you wanted to add? Last?
No, I don't think so. I think maybe just one thing is that, like, one of the biggest takeaways is that we've kind of established from this initial survey is that we have so much interest and engagement and opportunity to really build these practices based around like what your clients need, and are really hoping to kind of center the voice of clients moving forward. And that was identified a little bit as a barrier, especially with that like staff champion, like one person being like the motivator for programs, trying to solve or bridge these gaps. So really looking forward to the learning collaborative to kind of brainstorm and engage, and hopefully get a lot of engagement from clients as well through this process.
I think it's also good to be open to making mistakes and just trying things out. I know that even as simple as like pronouns, having them correct, you know, that is something we learn over time, and just being open. And if we don't get it, if we keep making, you know, make mistake, we just kind of move on and kind of say, okay, next time I'm gonna I'm really gonna try, and or these things didn't work out for this specific person. Let's try something else. So just kind of it's we all are learning this, and there's so much to learn. So just the humility of like, okay, teach us, like especially from each individual, they're all different. So it's nice to really see what works for you, and then I'm happy to learn from you and see what we can do, how we can make you feel more accepted, more welcome. Tell me, I'm willing to listen. If I make mistakes, that's fine. It's modeling that that we are really open for growth. So I think that's also my message.
I love that, Mayang. That also just reminds me that a lot of the principles for providing gender affirming care are the same principles for providing high quality medical respite care in general. It's just extending the same values and standards of care to everybody, regardless of gender identity. So things like centering client choice, client autonomy, making informed decisions, making sure everybody is respected and not harassed. All of those things are basic standards of care that you can use as a strategy in securing leadership buy-in and saying these are already things that we pursue as medical respite program. These are already things that we have in our policy manual, and we're just making sure it's applied equally to everybody. And it may involve, learning some language, practicing, like Mayang mentioned, joining a national learning collaborative so you can talk with other people in a safe space who are also learning. But that what matters is that you start and make the effort and make sure to prioritize the lived experience of guidance of people who you're serving. I think is something that NIMARC does a great job at centering in all of their work. So just a reminder to
Hey, Kelly,
follow us on social. Yeah, go ahead.
Oh, sorry. Holly has a hand raised.
Go ahead, Holly.
Yeah, the second question that was there is what successes have you had? So far in the 5 years I've done medical respite, we've only seen one person that's come through that we know was trans. And she came in, she was still dressing as a male and was very concerned about coming out. And I think through a couple of us who talked about friends of ours who are trans, or just knowing that she was thinking about this transition, she finally was like, I'd really like some female clothes. So we made sure that she had female clothes. And because she was very stressed out, I got her connected to our behavioral health specialist, who got her all kinds of makeup and jewelry. And, then she just started to bloom. And we had started a walking club, and she was the only one who would join, myself and one of the nurses. And she said, when I first started coming out here to walk with you guys, I would hide between the two of you. And she said, and then I think one of the last times before she moved out and got her own apartment, I said, you don't seem too shy now. And she said, now I don't care. She said, because I had people that were supporting me that said I was beautiful and said that I can be who I want to be, and didn't make judgments about what I was doing with that, even though she had had some really bad close calls with drug addiction and other behaviors. She said, you didn't give up on me. And that's a lot what I hear from everybody in medical respite is, you didn't give up on me. And especially, I can only think of a few people who out and out came out and told us that they were gay. Most of the people who come, they just don't They don't declare that when we do our intakes. They don't tell us they're gay and all of that until I start to tell stories of some of my friends. And, I went to this rally or did this and stuff. And then they still don't want us to change anything in our HMIS, but at least they become open to you. So I think, for me, one of the key factors is to let them know that you're an ally of theirs, so that they feel comfortable to just take little steps in trust. And if those don't, blow them up, then they'll take more. So that's just my little success story.
Yeah, thank you for that, Holly. Kelly, you're not on my screen, are you back? Okay, great.
Yes, I'm back.
Well,
sorry, y'all.
Thank you so much, everyone, today for your time and helping us set this stage a little bit so we can build a platform to work off of as we continue to try to improve gender-affirming medical respite care services. So as Kelly said, a great place to learn more about NIMARC is through signing up for our mailing list. Also, I did put myself and Kelly's emails up in the chat earlier, but we are available for any kind of one-on-one like consultation, or if you have any feedback, we would love to hear it. We also do have some example policies of both like violence or anti-gender discrimination policies that some programs have very graciously shared with us that we can share as well. So if you are interested in building anything into your program, we would love to talk to you. We would also love you to come to learn more about our learning collaborative and see if it's something that feels like a good fit for you, or if you have any other community members who may be interested. And you can follow us on a lot of social media. So thank you so much, Mayang, for your time today. Really appreciate it.
Thank you.
And thanks everyone who came. Really appreciate you being interested. And hopefully this is the beginning of our conversation about this. So on that note, I think we can end the meeting.
Thank you.
Okay, thanks.
Thank you.
Bye.
Bye-bye.